Scaling virtual care definitely comes with its own set of challenges. Many providers are used to traditional paper-based systems, and shifting to digital can feel overwhelming. It's like taking them out of their comfort zone, adapting to new things. So that's been the biggest challenge, like adapting to something. Imagine if you are in a residential assisted living facility with 70 some people living there, right? And now you find one person is basically idle on the staircase. A system can alert the administrative office like, hey, somebody's stuck over there, go take a look at it. He's been there for over 2 minutes or 3 minutes. So if you want digital document libraries, right, we got you covered. Now
Mhm.
you're paying a separate subscription for e-signing. You don't have to do it. It's all covered here. You get the providers get to save a lot of money in this way. Caregiver and actually their video with their permissions, they actually, the seniors do respond to their caregivers because they take care, right? Not in a strange
Right.
voice, a machine can actually talk to them. So what we have started doing is the conversational AI. Our dedicated research and innovation team is at the heart of all this. They are constantly exploring what possible, guided by one question: how can we make life better for our providers and seniors they care for?
Welcome to the Digital Health Transformers podcast, where we dive into innovations that are reshaping healthcare. I'm Greg Cave. Today, we're exploring Telehealth 2.0, how virtual care is evolving and where it's headed next. With us is Pallav Saxena, CEO of myEZcare. Pallav, thank you for joining us today.
Thank you. Excited to be here and share insights about how technology is transforming care coordination and improving the quality care of care across home healthcare and long-term post-acute care. It's kind of very critical nowadays. So thank you for being invited to this podcast.
No, it's absolutely our pleasure. We love to talk with companies that are innovative and on the forefront of healthcare and transforming healthcare. So, Pallav, can you tell us what inspired you to start myEZcare? How did you come to see the need for new solutions in home healthcare and virtual care?
Absolutely. Um, I started my EasyCare because I witnessed firsthand how healthcare providers were struggling with endless paperwork, complex scheduling, and regulatory challenges. It was clear that these administrative burdens were taking their time away from patient care. Additionally, I observed that many smaller agencies were either facing prohibitively high subscription costs or were forced to compromise with the limited support and features features in order to reduce expenses. I got inspired while working through with the healthcare, being in so long with this industry. I wanted to create a solution that would simplify these processes and improve the care coordination so that caregivers would simplify these processes uh, and dedicate more time to delivering quality care. Our mission at myEZcare is all about democratizing senior care. We are dedicated to making healthcare accessible to all the seniors by reducing the cost of care and improving the quality of care. I'm seriously very proud of being part of that movement that's reshaping how care is delivered for our aging population.
It's super important as someone who has parents that are, entering the healthcare system in that way. It's very important for me to understand, and it's good to know that there are companies like myEZcare out there that are looking to do better. And in telehealth, it has evolved, of course, a lot over the years.
Yeah.
How would you describe telehealth 2.0 compared to the early days of virtual care?
Yes. I mean, telehealth took a big jump during the COVID.
Yeah.
Everything was in home, and then patients needed care, and how to actually provide the care by keeping the caregivers and the patients safe at the same time, So that's where it took a big jump. And now, once we reached to a maturity level where everybody was comfortable adapting to the telehealth, then the Telehealth 2.0 came up. So, great question. When telehealth first became the mainstream, it was really just about connecting patient to providers over video. It was convenient but limited. Now, what we are seeing now is what is called Health 2.0. It's no longer just about virtual visits. It's about creating a connected, intelligent care experience powered by AIT and IoT. Today's telehealth integrates real-time data from remote patient monitoring devices, allowing providers to make more informed decisions from a distance. It's like having a window into the patient's world 24/7 and not just during the appointment. So at myEZcare, we saw this opportunity and we saw that there's a great opportunity to actually improve the care in this way. And we have taken this to our heart. Our system enables continuous monitoring, uses AI to flag early warning signs, so caregivers are notified the moment human intervention is needed. Not that they have to sit with them 24/7 all the time.
Right.
It's proactive and it's not reactive. This isn't just for hospitals, it's across the board: home health, adult day health, hospice, residential assisted living, you name it. Anywhere the seniors are there, they need some kind of an oversight and for their care, which is not available, and it's all possible with our IoT devices. So, by automating routine tasks, giving providers smarter insights, we are not only reducing the cost, we are actually improving the care also. So that's what Telehealth 2.0 is all about. Smart, more compassionate, more connected care that truly meets the people where they are.
Absolutely. I remember when you speak about COVID, it was essentially uh, telehealth was essentially a glorified FaceTime platform, right? Where there was no
Yes.
technology behind it. It was just about, like you said, that face to face visual connection. And I'm sure it was helpful, but yeah, you're right. You mentioned a lot of pieces there that I didn't even consider. And you're right, they're absolutely all a huge part of Telehealth 2.0. In that case, what do you see as the main reasons providers are now embracing these new telehealth solutions?
Well, there are several reasons why these solutions like ours, myEZcare, are really resonating with the providers. First, there's accessibility. These platforms extend care to remote and underserved communities, ensuring that every patient gets timely help. Second, they bring the efficiency by automating routine tasks without getting overwhelmed. For example, imagine an elderly patient who goes to the bathroom or the restroom and who every night before going to the bed at 10 p.m. comes out for
Mm,
about and comes out in about 20 minutes. For some day, he doesn't come out in another 25 minutes or 30 minutes. Our system will detect an unusual activity, automatically makes a call using a conversational AI to check if everything is okay, and or if there might be some kind of monitoring issue or a IoT device issue or something. But if there's no response, and then if there's no response, it alerts the responsible caregiver to look into the situation and go there. And this proactive approach is critical, especially considering that falls are the major health risk for the seniors. 1 in 4 older adults falls each year, leading to millions of dollars for emergency visits and hospitalization. A classic
wow.
example, long time back, a very uh, an old lady used to live next door to my house. She went to the
Hmm.
bathroom. Basically, literally, it was in the early days. I was in a condo there at that time, and next door, and she fell in the
Hmm.
bathroom, and she was there for 3 days, trying to sip
Wow.
the water through the tap to survive. And we nobody has any idea. 3 days later, a friend of hers actually, when she couldn't contact her, she reached out to the cops and she reached out to the and it told the authorities, and they came in and found her in the bathroom with her
Mm.
kind of like some fractures on her back and all that stuff happened. So these are the things like IoT devices can save lives. An instance. Another example is like somebody is basically sitting on the couch for too long and not moving around. On a normal day, they normally do move around. Our system can detect and actually tell the caregivers, hey, there may be some problem with this individual. We see that the diagnosis is showing some kind of a diabetes. So maybe he or she has a swelling in her legs, so needs a doctor's visit immediately. So
That,
those are the things. Then the third thing is the patient engagement. So the patient engagement is enhanced through the user-friendly interfaces and personalized notifications like friendly voice-based medication reminders that help the patients feel connected to their care. And finally, these solutions address the rising cost of care, workforce challenges by streamlining operations, reducing overheads, and freeing up the precious time of the caregivers. This way, even a smaller team of providers can provide a high quality, compassionate cares to a larger or bigger population.
those are such great points, especially so those are great points obviously for the caregiver, but on the user side, it really gives a sense of independence that's often lost at this stage of life, especially if you don't have support. So wow, my easy care is really providing a great solution, and enabling a lot of seniors, it sounds like, remain independent, which is so important to so many people. Wow,
Absolutely.
that's awesome. Let's talk about mobility, Pallav. How does having mobile access change the way care is delivered?
Well, mobility is truly a game changer in care delivery. For me, it means that as a caregiver, you're never out of touch. Whether you are at the patient's home, traveling between the visits, or simply on the move. Having vital patient information right on your smartphone or tablet makes all the difference. Imagine being able to instantly check on patient's status, update care plans, or receive real-time alerts about any changes. Uh, this kind of a connectivity ensures that help is always just a tap away. It's not just about efficiency, it's about adding a human touch as well. Our platform sends friendly voice-based reminders for medications and other care needs, almost like reassuring conversations. This personal interaction helps patients feel cared for and connected, and even when they are on their own, they never feel alone, like, okay, fine, somebody's looking after them. In essence, mobile access empowers both caregivers and patients, making care delivery more responsive, compassionate, and truly personalized.
I
Right?
couldn't have said it better than myself. Yeah,
Yeah.
that's amazing.
A beautiful example is like reminding Mary, can you please take the green pill? You didn't take the green pill today. Or working with a dementia or Alzheimer's patient and just having timely talking, the AI talking in a conversational AI and playing some kind of a game that can exercise her brain. Very
It's super
interactive
important.
kind of things.
Yeah, it's such a small thing, but so many people don't have that access, and it's
Yes.
so helpful. So it's amazing. myEZcare really implements that into your solution. I think that's awesome. When we talk about scaling virtual care, it doesn't go without its challenges. So what hurdles have you at myEZcare faced, and how has myEZcare overcome them?
Yes. Scaling virtual care definitely comes with its own set of challenges. Many providers are used to traditional paper-based systems, and shifting to digital can feel overwhelming. It's like taking them out of their comfort zone, adapting to new things. So that's been the biggest challenge, like adapting to something, explaining everything, especially with this population, where a lot of people feel a little apprehensive about, like, oh, should I use it or not, kind of thing. So yeah, it was very challenging, especially in the user adoption side of it. And so here's this transition. We designed MyEZcare with an intuitive interface and offer very dedicated support at every step of the way. Our system adoption is very simple and hassle-free. It is built so that there's literally no learning curve. The point being is basically you can make a brilliant system, but if there's no user adoption, the product is a failure. And one of the core principles at myEZcare that we have is we do not create the process and ask our users to align. We look at their process and align our system to their processes. If you are doing it this way, we'll make the system to do it this way only, not this way. We ensure that. Another big hurdle is ensuring smooth communication among care teams is spread across different locations. For example, one of our partner agencies used to struggle with coordinating schedules, sharing timely updates, which sometimes led to missed follow ups, delay in care. With our platform, the real time data sharing and integrated messaging, every team member can quickly access and update the critical patient information at any moment of time. Plus, our smart home integrations were known wearable sensors discreetly mounted on the walls. It's not like a ring or a band or anything like that. So they are mounted on the walls. They continuously track patient activity and ensuring that if any unusual behavior is detected, such as an extended period in one area, our server system immediately triggers an alert. Imagine if you are in a residential assisted living facility with 70 some people living there, right? And now you find one person is basically idle on the staircase. A system can alert the administrative office like, hey, somebody's stuck over there, go take a look at it. He's been there for over 2 minutes or 3 minutes. Immediately a help
Right.
can go out, maybe a seizure or maybe something happened.
Right.
So this proactive approach not only reduces errors, but also helps even a leaner team to provide a very quality and timely care.
It absolutely sounds that way.
Yeah.
I mean, as you're talking, I'm thinking of so many different use cases, and it's really such a great system. How do
Oh,
you?
we have got thousands of use cases for these kind of
I'm
things. I
sure of
mean,
it.
more we think,
Abs-
more we find, you know.
Absolutely. How do you keep your solutions accessible and affordable for everyone?
Um, uh, can, can you repeat your question, please? I think I missed it.
No, I'm sorry. I was just saying, based on we were talking about all the different use cases, which is incredible. How do you keep your solutions accessible and affordable for everyone, Pallav?
Great question. Great question. We truly believe that every healthcare provider, regardless of the size, should have access to the best technology without it being cost prohibitive. So at myEZcare, we offer flexible pricing models tailored for each organization needs. This means that even with smaller agencies, which often struggle to pay high subscription costs and are forced to settle with limited features, can access a robust all-in-one platform without compromise. Um, how we do it is basically very innovative. What we do is basically we actually build up the partnerships and negotiate the cost of a lot of different kind of services like claim processing or any other services. We reduce the cost of that, and then on top of it what we do is we do show the value of the product itself that actually helps in their operating overhead. So we combine
Mm,
essential functions like scheduling, billing, patient records, and even smart home alerts into one intuitive solution, eliminating the need for multiple subscriptions or reducing the overall cost. So if you want digital document libraries, right, we got you covered. Now
mhm,
you're paying a separate subscription for e-signing. You don't have to do it. It's all covered here.
mm.
You get the providers get to save a lot of money in this way. Now, if you're using a claim processing or a biller cost, our AI system can do an automated claim processing as we are partnered with every payer in the country. We can
Wow.
submit the claims electronically, track their payments, and then reconcile their payments back into the system using AI without even the need of a medical biller. That's a
Wow.
straight up savings for them.
That's a huge one.
So there's a lot of those kind of things. Like if a caregiver is basically sent to a particular place and staying with the same patient or just going on multiple trips to um, remind for the medication or administering the medication, self-service
Hmm.
medications with the IoT devices can actually get these taken care of. And caregivers would only need to visit the patients who missed out their medications or critical medications at a certain time. So that actually saves a lot of time and cost for these providers also. So all in all, a low-cost subscription can help them save a lot of money that can they put towards growing their agency or company and provide the quality care while we can actually operate with that affordable price. So
It's great
that's
that you
a secret recipe.
no, and it's clear that you guys are really looking at the totality of the concern, not just the telehealth piece, but the whole engagement, and cost is a big part of it. So
Right.
allowing these caregivers to really use the platform to get it to the people that need it the most, and you guys are really addressing all those concerns. That's really awesome. Looking towards the future, Pallav, what trends do you think will shape the next phase of virtual care in healthcare and telehealth? Sorry.
Well, I would say the future of virtual care is truly exciting. We are on the brink of new era driven by the AI and automation. Imagine smart home systems that not only monitor a patient's daily routine, detect unusual activities, and when the chip and detect unusual changes, like when seniors' routine is disrupted, or immediately alert the caregivers if something seems off. Sometimes their routines might change and they might not be disruption, but they might have adjusted to something. AI can learn that and actually make changes to their alert and notification systems and change their thresholds of alert and notification also.
Wow.
Um, so remote monitoring will definitely play a big role. Think about it as a non-intrusive sensors and advanced devices that continuously track health metrics, giving us early warnings if a patient's condition has started to decline. This proactive approach can dramatically reduce the hospital admissions, improve outcomes across the home health care and long-term post-acute care, adult day health, residential assisted living, and hospice settings. Um, our healthcare systems become more interconnected, seamless interoperability will ensure that all this valuable data flows effortlessly between the providers. And this integration will make the care coordination way more smoother, better, efficient, and ultimately helping in delivering the right care at the right time to every senior. Moreover, the key aspect of this evolution is remote patient monitoring for self-service care, which is now reimbursed by Medicare also. So at myEZcare, we are already offering remote monitoring, chronic care management for hypertension, and and demonstrating that these innovative technologies are making a tangible impact in the real world care management. Also, virtual care will enable a lot of self-service care as well.
Yeah.
Self-medication administration, a lot of self-care that will happen, which will help in managing the increasing cost of the care also.
Yeah.
So, in essence, trends like AI-driven insights, enhanced remote monitoring, and improved data integration is going to make the healthcare way more effective, accessible, compassionate for aging population. And another fun thing is basically the conversational AI, which we have started piloting with our clients now. A simple device with a video monitor. We clone the
Hmm.
voice of the caregiver and actually their video with their permissions. The seniors do respond to their caregivers because they take care, right? Not in a strange
Right.
voice, a machine can actually talk to them. So what we have started doing is the conversational AI and the voice and the face of their own known caregiver would start talking to play the game so that their brains can be exercised, asking them to move around or take the medications on time and getting their well-being every now and then, like every 1 hour. Mary, how are you doing today? Are you feeling okay? I'm right here for you. Do you need any help? It's an amazing thing. They never feel alone now.
No, and I think the piece that resonated with me the most in what you just said was around the self-service piece. I think you're right. I think that's the biggest kind of thing that we'll be seeing in the future within telehealth, and incorporating those pieces, just like you said, is a big part of that. That's awesome.
Right.
Pallav, finally, how does myEZcare plan to keep innovating in this fast-changing field?
Oh, well, that's a big question. We are doing a lot.
Yeah,
This year we are more invested in innovation than ever before, especially in AI and IoT, because we truly believe the future of our care depends on it. Our goal isn't just to adapt where healthcare is headed. We are working to lead the way in shaping it. We made a major commitment to the AI initiatives this year, pouring resources into building smart, intuitive systems that simplify workflows, reduce the frictions, and deliver insights before they are even needed. But we are not stopping there. We are pairing that intelligence with next level IoT capabilities, connecting devices, wearables, and sensors that enable real time remote monitoring like never before. Imagine a world where caregiver can track vitals, spot warning signs, intervene early, all without adding to their workload, and that's what we are building. From chronic care management to medication adherence to remote patient monitoring under Medicare, we are creating a seamless ecosystem which everything just works together effortlessly. Our tech just doesn't respond to needs, it anticipates them. Our dedicated research and innovation team is at the heart of all this. They are constantly exploring what possible, guided by one question: how can we make life better for our providers and seniors they care for? Every product, every feature, every update is rooted in real feedback from the field. Our customer advisory board is plays a very critical role in every initiative that we take in our company. While we are not chasing trends, we are setting them. Our
exactly.
mission is to democratize senior care through powerful, accessible tools, and we are proud to be paving the way with AI, IoT, and remote monitoring that actually makes a difference. And we are moving fast, we are thinking big, and we are all in because better care cannot wait. And not just in US market, not in European market. There are other parts of the world and anywhere in the universe, every person age and they need the
Yep.
care when they get old. And that's what our mission is, to democratize the care across the globe for every deserving senior. So that's it.
And that's amazing. And it really it's clear that myEZcare is taking something like telehealth and really making sure that people understand it's not just an add-on. It's a critical piece of the entire healthcare solution by exemplifying some of the solutions that you guys are providing and really pushing them in a way that makes it easier. So I want to thank you for this conversation, Pallav. You really gave me a lot of insight. I also want to thank all of our listeners for joining us on this episode of Digital Health Transformers. For more insight on how myEZcare is making a real difference in care coordination and the quality of care, be sure to visit our website and connect with our community. Until next time, stay engaged and keep transforming healthcare. Thank you so much, Pallav.
All right, thank
And
you.
that's it. It
All
was my
right,
pleasure. I really appreciated it. And excellent insights. And again, like I said, we'll be sharing this for you after the team is kind of taking care of it in post. And I look forward to speaking with you in the future. You have a great day.
absolutely. Pleasure's all mine. Thank you so much.
Thank you. Bye bye now.
Bye.